My name is Angela Nicola, and I am the Diabetes Care and Education Specialist for our diabetes program. I've been here at Tribal Health for over 4 years, working with our diabetes patients. I've also been practicing as a nurse for over 12 years. Today is our annual Go Red for Women event, a little different from the years before due to COVID. But we are trying to be safe for you and our community, and it's virtual this year. The American Heart Association Go Red for Women movement is to raise awareness about cardiovascular disease. So today I will be talking about our diabetes program and our role in helping prevent cardiovascular events such as stroke and heart attack. People with diabetes are twice as likely to have a heart attack or stroke than people without diabetes. Some other risk factors include high blood pressure, high LDL, which is your bad cholesterol and triglycerides, low HDL, which is your good cholesterol, too little physical activity, smoking, or not being in your target range for your weight. Our diabetes staff will do our best to help you avoid any kind of health complications, such as heart disease. And one way we can help you start is helping you manage your ABCs. A is for A1C, B is for blood pressure, C is for cholesterol, and S is for smoking. A1C is an average of your blood sugars over 3 months. And the goal is to have your A1C 7.0 or below. In some cases, your doctor may vary that a little bit depending on your age and other chronic illnesses you may have. And B is your blood pressure. You want to have that below 140/90. And again, your doctor can vary that range some depending on your age and other factors with your health. C is cholesterol, again, and S is smoking. A lot of people that get diagnosed with diabetes, one of the first questions they may ask is, what can I eat or what can't I eat? As a diabetes educator, we can certainly educate you on nutrition guidelines and direct you to, educate you to always look at the labels, the nutritional labels. We can also refer you to one of our registered dietitians where you can have more in-depth education one-on-one, which the research shows that meeting with your registered dietitian regularly can decrease your A1C by 1 to 2 points. We can work with you and support you in other areas such as physical activity and giving you guidelines as far as the recommended amount is about 30 minutes a day, 150 minutes per week. You want to get your heart rate up a little bit. You can ride bikes, you can walk briskly, you can swim. You definitely want to check with your doctor to make sure that if you have any injuries or if you have any limitations, that you do check with your doctor beforehand. We can help you educate you more on your blood sugars, when to check them and what your target range should be. For instance, in the morning, your fasting blood sugars should be between 80 and 130. Checking your blood sugars before a meal and checking your blood sugars 1 to 2 hours after a meal. We can help you understand your medications more, how they help with your blood sugars or how they have a factor in lowering your blood sugars. We can try and help you problem solve. We can try and direct you into other resources, such as like coping with the emotional side of dealing with diabetes daily, or receiving a diagnosis of diabetes. We have our behavioral health department that we can certainly guide you and help you make an appointment. And we have other resources here at Tribal Health also. I always tell my participants, if this was easy, none of us would have diabetes. None of us would have chronic illnesses. We'd all be at our ideal weight. But it's challenging. You know, when we're told that we have to change our lifestyle, we have to monitor what we're eating, we have to be more physically active. It can be difficult for some, and so that's why we're here. Our diabetes program is to help you and to support you and educate you to the best of our ability to guide you and self-manage the best that we can. And we use the AADE curriculum, diabetes curriculum, which is the American Association of Diabetes Educators. And a small part of what we do in our sessions, our diabetes sessions, is talk about SMART goals. And again, the research will show you that if you can set small goals, you can be more successful as if you didn't set any goals at all. It's an acronym, SMART, for specific, measurable, achievable, /action, relevant, and time-bound. An example would be, a specific goal would be, I am going to lower my blood pressure to 130/80 in 3 months. Measurable, meaningful could be, I'm going to start walking for 30 minutes 3 times this week. An achievable action would be, I am, what would that be? Start checking my blood pressure and daily, weekly, and write down in on a calendar or in a journal. Relevant, I will talk with my diabetes educator or provider with any questions that may arise. Time bound, every month I will reassess and reevaluate to get to my goal in 3 months. So that's just one goal that you could work on to help decrease your risks of a cardiovascular event. Decreasing your cholesterol level would be another one. Having more physical activity. Unfortunately, right now, we're still not meeting with our patients face-to-face in groups, but our staff will meet one-on-one, in person. We have virtual classes via Zoom. I will meet with people virtually one-on-one also, and phone visits. Our goal, of course, is to prevent diabetes complications, help with self-management, and obviously with today's talk, decrease cardiovascular events. I want to thank you for joining me and listening. I hope you were able to get some little tidbit out of this this presentation, and I hope you enjoy the rest of the conference and be safe, wear your mask, get your COVID vaccination, and thank you. Take care.